That familiar wave, the sudden darkening around the edges of your vision point. 1 minute you're sitting comfortably, the next, the world decides to tilt on its axis as you stand. That woozy, lightheaded sensation is something most of us have experienced at some point, that brief, unsettling moment of dizziness when standing up. It's surprisingly common, affecting people of all ages, although it tends to become more frequent as we get older. I remember once rushing to answer the phone after a long afternoon gardening. I sprang up from my kneeling position a little too quickly, and the room swam before my eyes. I had to grab onto the nearby table to steady myself, the phone ringing insistently in my ear, a distant, distorted sound. It was a stark reminder that even simple actions can trigger this frustrating phenomenon. But what exactly causes this sudden imbalance? Often, it's a temporary drop in blood pressure, a physiological hiccup as your body adjusts to the change in position. We'll delve into the mechanics of why this happens, exploring the intricate dance between your heart, blood vessels, and nervous system. That fleeting feeling of imbalance has a name: orthostatic hypotension. Also sometimes referred to as postural hypotension. It sounds intimidating, but it simply describes that drop in blood pressure that occurs when you stand up quickly. But how significant does the drop need to be before it's considered orthostatic hypotension? Medically speaking, it's defined as a decrease of at least 20 millimeters of mercury in systolic blood pressure, the top number, or at least 10 millimeters of mercury in diastolic blood pressure, the bottom number, within 3 minutes of standing. So, if your blood pressure is normally around 120/80 and it drops to 100/70 or lower upon standing, that would likely qualify. It's important to note that a slight dip in blood pressure upon standing is normal. Our bodies are usually pretty good at compensating quickly, but when the drop is significant enough to cause symptoms like dizziness, lightheadedness, blurred vision, or even fainting, then it's considered orthostatic hypotension and warrants further investigation. The severity of the symptoms can vary widely from person to person, some barely noticing it, while others find it completely debilitating. So, what triggers this unwelcome dip in blood pressure? The causes of orthostatic hypotension are surprisingly diverse, ranging from simple lifestyle factors to more complex underlying medical conditions. Let's explore some of the most common culprits. Dehydration is a frequent offender. When you're dehydrated, your blood volume decreases, making it harder for your body to maintain adequate blood pressure. Prolonged bed rest or inactivity can also weaken the muscles responsible for pumping blood back to the heart, contributing to the problem. Certain medications are notorious for inducing orthostatic hypotension. Diuretics, often prescribed for high blood pressure or fluid retention, can reduce blood volume. Ironically, some blood pressure medications, if not carefully managed, can lower blood pressure too much, leading to dizziness upon standing. Antidepressants, particularly tricyclic antidepressants, can also have the side effect. Beyond these factors, heart problems like heart failure or valve disorders can impair the heart's ability to pump blood effectively. Neurological conditions, such as Parkinson's disease, can affect the nervous system's control of blood pressure. Finally, diabetes can damage nerves that regulate blood pressure, increasing the risk of orthostatic hypotension. Let's zoom in on one of the most common and easily addressable causes: dehydration. Think of your blood as the river that carries vital nutrients and oxygen to every corner of your body. When you're dehydrated, that river shrinks, reducing the overall volume of fluid circulating through your veins and arteries. This lower blood volume makes it harder for your body to maintain adequate blood pressure, especially when you stand up and gravity pulls blood downwards. So, how do you combat dehydration and keep your blood volume at a healthy level? The key is consistent hydration throughout the day. Don't wait until you feel thirsty. That's a sign your body is already starting to become dehydrated. Aim for a steady intake of water, especially during warmer weather or after exercise. A good rule of thumb is to drink at least 8 glasses of water a day. But individual needs vary depending on activity level, climate, and overall health. Carry a water bottle with you as a constant reminder to sip throughout the day. You can also incorporate hydrating foods into your diet, such as fruits and vegetables with high water content like watermelon, cucumbers, and spinach. Avoid excessive consumption of caffeinated beverages and alcohol, as they can have a diuretic effect, further contributing to dehydration. Beyond hydration, Another critical step in managing orthostatic hypotension is a thorough medication review. It's easy to overlook the potential impact of your medications on your blood pressure, but many commonly prescribed drugs can contribute to dizziness upon standing. This isn't to say you should stop taking your medication without consulting a doctor, but rather to emphasize the importance of open communication with your healthcare provider. Schedule an appointment to discuss your concerns and review all the medications you're currently taking, including over-the-counter drugs and supplements. Be sure to mention any instances of dizziness or lightheadedness you've experienced. Certain medications are more likely to cause problems than others. Diuretics, as we mentioned earlier, reduce fluid volume. Alpha blockers, often used to treat high blood pressure or prostate enlargement, can relax blood vessels and lower blood pressure. Some antidepressants, particularly tricyclic antidepressants, can also interfere with blood pressure regulation. Even some medications for Parkinson's disease can have this effect. Your doctor can assess whether any of your medications are contributing to your orthostatic hypotension and explore alternative options or dosage adjustments. Now, let's talk about simple yet effective techniques you can implement in your daily routine to minimize dizziness. One of the most straightforward strategies is to practice gradual position changes. Instead of leaping up suddenly, give your body a chance to adjust. When you're lying down, take a moment to sit up slowly. Dangle your legs over the side of the bed or chair for a minute or two before standing. This allows blood to gradually redistribute, giving your blood pressure a chance to stabilize. Before you fully stand, take a few deep breaths. When you do stand, do so slowly and deliberately. If you feel lightheaded or dizzy at any point, stop and hold onto something sturdy for support, like a chair, table, or wall. Wait for the dizziness to subside before continuing. It might feel awkward at first, but with practice, these gradual movements will become second nature. For those who are particularly prone to dizziness, consider keeping a sturdy walking stick nearby for added stability. These slow, deliberate actions can make a world of difference in preventing those disconcerting episodes of imbalance. Let's move on to another valuable tool in your arsenal against dizziness: leg muscle activation. Your leg muscles play a crucial role in circulating blood back to your heart, acting as a natural pump. When you stand, gravity pulls blood down into your legs and feet. Activating your leg muscles helps to counteract this effect, squeezing the veins in your legs and pushing the blood upwards. Simple exercises can significantly improve this process. Ankle pumps are a great starting point. While sitting or lying down, repeatedly point your toes up towards your shins and then down towards the floor. This engages your calf muscles and promotes blood flow. Leg raises are another effective exercise. While sitting, extend one leg straight out in front of you, hold for a few seconds, and then lower it back down. Repeat with the other leg. Calf raises, performed while standing, holding onto something for support, involve rising up onto your toes and then slowly lowering back down. Aim for 10 to 15 repetitions of each exercise several times a day, especially before standing up after prolonged sitting or lying down. Incorporating these exercises into your routine can act as a natural blood pressure boost, helping to prevent dizziness. Another helpful tool in managing orthostatic hypotension is the use of compression stockings. These specialized stockings provide graduated compression, meaning they are tighter at the ankle and gradually loosen as they go up the leg. This gentle pressure helps to squeeze the veins in your legs, preventing blood from pooling in your lower extremities and promoting better circulation back to the heart. By reducing blood pooling, compression stockings help to maintain adequate blood pressure when you stand up, thereby minimizing dizziness. They are particularly beneficial for individuals who spend long periods standing or sitting, or those who have poor circulation in their legs. Choosing the right fit is crucial for compression stockings to be effective. It's best to consult with a healthcare professional or a trained fitter to determine the appropriate level of compression and size for your needs. Compression levels are typically measured in mmHg, millimeters of mercury. Mild compression, 15 to 20 millimeters of mercury, is often sufficient for preventing mild dizziness, while higher levels of compression, 20 to 30 millimeters of mercury or 30 to 40 millimeters of mercury, may be recommended for more severe cases. Ensure the stockings fit snugly but are not too tight, as this can restrict circulation. They should be worn throughout the day, especially during activities that trigger dizziness. Let's now consider how dietary adjustments can play a role in managing orthostatic hypotension. While it might seem counterintuitive, Increasing salt intake under the guidance of your doctor can sometimes be beneficial. Sodium helps to increase blood volume, which can help to raise blood pressure and reduce dizziness. However, it's crucial to emphasize that this should only be done under medical supervision, as excessive sodium intake can be harmful for individuals with certain underlying health conditions, such as heart failure or kidney disease. Another helpful dietary strategy is to eat smaller, more frequent meals throughout the day. Large meals can sometimes cause a sudden drop in blood pressure, particularly after eating, a phenomenon known as postprandial hypotension. By eating smaller, more frequent meals, you can help to stabilize your blood sugar levels and prevent these sudden blood pressure fluctuations. Focus on incorporating balanced meals with lean protein, complex carbohydrates, and healthy fats. Avoid processed foods high in sodium and sugar, and prioritize whole, unprocessed foods. Staying well hydrated throughout the day is also crucial, as we discussed earlier. Equally important to preventative measures is the ability to recognize the early warning signs of dizziness. Being able to identify these signs allows you to take immediate action and prevent a potential fall or fainting episode. Pay attention to subtle changes in your body. Common early warning signs include lightheadedness, a feeling of unsteadiness, blurred vision or spots in your vision, weakness, and a general feeling of being unwell. You might also experience a sensation of your heart racing or pounding. If you notice any of these symptoms, the most important thing to do is to sit or lie down immediately. This helps to increase blood flow to your brain and prevent a more serious episode. If you're able to, elevate your legs slightly to further improve blood circulation. Once you're in a safe position, take slow, deep breaths. This can help to calm your nervous system and stabilize your blood pressure. Stay in that position until the symptoms completely subside before attempting to stand up again. If you're prone to dizziness, it's a good idea to carry a small snack or sugary candy with you to quickly raise your blood sugar levels if needed. While many cases of dizziness are benign and can be managed with lifestyle adjustments, it's crucial to know when to seek medical attention. If you experience frequent or severe episodes of dizziness, it's essential to consult with your doctor for a thorough evaluation. Don't dismiss it as just something that happens. Pay particular attention to any accompanying symptoms. Dizziness accompanied by chest pain, shortness of breath, blurred vision, difficulty speaking, weakness on one side of the body, or fainting warrants immediate medical attention. These symptoms could indicate a more serious underlying condition, such as a heart problem, stroke, or neurological disorder. Even if the dizziness isn't accompanied by these alarming symptoms, it's still important to seek medical evaluation if it's significantly impacting your quality of life. Your doctor can perform a physical exam, review your medical history and medications, and order tests to determine the underlying cause of your dizziness. These tests might include blood pressure measurements taken while lying down, sitting, and standing, as well as blood tests to check for anemia or other medical conditions. Early diagnosis and treatment can help to prevent complications and improve your overall well-being. It's important to reiterate that orthostatic hypotension is often a symptom of something else. While lifestyle modifications can certainly help manage the symptoms, it's crucial not to overlook the possibility of an underlying medical condition contributing to the problem. Think of dizziness as a warning light on your car's dashboard. It signals that something isn't quite right and needs further investigation. Conditions like heart failure, valve disorders, Parkinson's disease, diabetes, and autonomic neuropathy can all disrupt the body's ability to regulate blood pressure effectively, leading to orthostatic hypotension. Addressing these underlying conditions is essential for long-term management of dizziness. Your doctor will work to identify any potential underlying causes through a comprehensive evaluation. This may involve blood tests, an electrocardiogram, ECG, to assess heart function, and neurological tests to evaluate nerve function. Once the underlying cause is identified, your doctor can develop a treatment plan tailored to your specific needs. This may involve medications to manage heart conditions, regulate blood sugar levels, or address neurological problems. By treating the root cause of the problem, you can often significantly reduce or eliminate the symptoms of orthostatic hypotension. Before we move on, Let's take a moment to consolidate the lifestyle modifications we've discussed. Remember, managing orthostatic hypotension often involves a multi-pronged approach. First and foremost, prioritize hydration. Aim for consistent fluid intake throughout the day, especially during warm weather or after physical activity. Practice gradual movements. Avoid sudden changes in position. Sit up slowly, dangle your legs, and pause before standing. Incorporate leg exercises into your daily routine. Ankle pumps, leg raises, and calf raises can help to improve blood circulation and prevent blood pooling in your legs. Consider using compression stockings. These can help to support your veins and promote better blood flow back to the heart. Make dietary adjustments. Under medical guidance, you may benefit from increasing your salt intake and eating smaller, more frequent meals. By consistently implementing these lifestyle modifications, you can significantly reduce the frequency and severity of your dizziness episodes and improve your overall quality of life. Remember, consistency is key. Choose one or two strategies to start with and gradually incorporate others as they become habit. It's vital to distinguish between manageable dizziness and situations that demand immediate medical attention. While we've covered many strategies to alleviate dizziness, certain symptoms should never be ignored. Consider these red flags that warrant a trip to the emergency room or a call to 911. Loss of consciousness, even for a brief moment, is a serious concern. Dizziness accompanied by chest pain, pressure, or tightness in the chest could indicate a heart problem. Difficulty breathing or shortness of breath should also be evaluated immediately. Any neurological symptoms, such as sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, vision changes, double vision, loss of vision, severe headache, or seizures, require immediate medical attention, as they could be signs of a stroke or other neurological emergency. Dizziness following a head injury, even a minor one, should also be evaluated by a doctor. If you experience any of these warning signs, don't hesitate to seek medical help. It's always better to err on the side of caution when it comes to your health. Prompt diagnosis and treatment can make a significant difference in your outcome. So, where does that leave us? We've covered a lot of ground, from understanding the mechanics of orthostatic hypotension to implementing practical strategies for managing dizziness. Remember, the key takeaways are these. Stay hydrated, move gradually, activate your leg muscles, consider compression stockings, and make informed dietary choices, always in consultation with your healthcare provider. Most importantly, pay attention to your body and seek medical evaluation when necessary. Dizziness doesn't have to rule your life. By taking proactive steps to manage your symptoms and address any underlying medical conditions, you can significantly improve your quality of life and regain control. It's about understanding your body, working with your doctor, and making informed choices that support your well-being. Take what you've learned here and start implementing these strategies today. Even small changes can make a big difference. You have the power to manage your dizziness and live a full and active life. Don't let a momentary imbalance hold you back from enjoying everything life has to offer. Embrace these tools, stay informed, and take charge of your health one steady step at a time.